In honor of National Period Day, I decided to create a special episode and I interviewed Dr. Lara Briden, who is the author of the Period Repair Manual. She published this book right before anyone was comfortable using the word period. And 5 years later, now everyone's talking about it. However, there's still a lot of information that women don't know but should. And I could not think of a more ideal person to interview for this special episode than Dr. Briden. Before we dive into the podcast, I wanted to announce a couple of quick things. One, Fempower Health Podcast is now an Alexa skill. Type in Fempower to find it, or you can go to my Instagram account at Fempower Health, and the link is in the bio. And if you have any feedback for me, I always love to listen to what you all need and desire, so please email me at info@fempower-health.com. Without further ado, let's start talking to Dr. Lara Briden. Welcome, Dr. Briden, to the Fempower Health Podcast. Thanks so much for joining.
Hi, Georgie. Thanks for having me.
So please introduce yourself.
Absolutely. So I'm a naturopathic doctor and the author of the book, Period Repair Manual. I'm Canadian, as you can probably hear from my accent, but I live in New Zealand and I spent nearly 20 years practicing in Sydney, Australia. So I have kind of I call three countries home. And I've just spent, the last nearly 25 years of clinical practice on the ground, pretty much 9 to 5, Monday to Friday, helping women have better periods with diet, supplements, herbal medicines. So I've had an opportunity, which I'm very grateful for, to learn what works and what doesn't work with thousands of women. I reached the point about 5 or 6 years ago where I thought I really need to share this information with not just my own patients, but women out there. So that's how the book came into being. The first edition, so it's in its second edition now, came out early 2015.
Okay.
So I don't know if you remember 2015, but I just have to mention it because that was the year of the period. Do you remember it was kind of declared the year of the period? That was the first time there was a lot of kind of mainstream media where they were actually using the word period for the first time. Women were talking about it openly in sport. And so that's only 5 years ago. It's been as you know, the world is changing very quickly, but even 5 years ago, even back then, in 2014, when I was getting ready to release my book, I had a few people say to me, I don't know if you should put the word period in the title of a book.
Oh dear.
Because it's kind of off-putting back then. So we've come a long way, right? So now 2020, that's pretty normal to say the word period. That's not not taboo anymore.
Oh my goodness. I mean, it really, and now did you write the book before that happened? So it was just amazing timing?
Yeah. The year my book came out in February 2015. And by the end of that year, it was declared the year of the period, not because of my book, I don't think, but just because of what was happening in the world. So yeah.
That is awesome. Awesome.
Yeah.
So let's talk about periods then, now that we're so comfortable using that word.
Yeah.
Maybe we could start with some of the myths that women have about periods.
I want to start with one of my key messages about periods is that ovulation is the main event of the menstrual cycle. The bleed itself is just a secondary downstream effect. I think the reason I start with that is because I think we put so much focus on the bleeding, and really it's actually, from a health perspective, it's not about that. I mean, we want the bleeding to be as easy and symptom free as possible, but the value of a menstrual cycle for women is ovulation, not just to be able to make a baby, of course that's part of it, but also because ovulation is how women make hormones. So men make hormones every day. They have quite a flat, pattern with their hormone production. We have this monthly pattern of hormone production, but that is, that has been treated sort of as a liability in some ways, that we have this fluctuation through the month. But I like to flip the script and reclaim that as it's an asset. We make hormones in this monthly pattern, but we need those hormones. Both estrogen and progesterone have many, many benefits beyond just making a baby. For example, there was just in the research mid-September, there was some new bit of research about how having more years of cycles, ovulatory cycles, reproductive years, is beneficial for reducing the risk of cardiovascular disease, after
Wow.
menopause, years later. So I call this, so one of the things I talk about is every ovulation, every menstrual cycle is like a deposit into the bank account of long-term health. It's building what's called metabolic reserve. I mean, most people would know that estrogen makes bones stronger. Progesterone makes bones stronger. Both hormones are good for the heart. Both hormones are good for the brain. They affect the microbiome or the gut. They're beneficial for us, just as testosterone is beneficial for men. So this is what it all hinges on. And the thing about this is, you can see it's not about the bleed. And the problem is, if on hormonal birth control, on the pill, we're in this weird situation where there's no ovulation, so no hormone production, and the contraceptive drugs are not as good as our own hormones. And then we have this monthly induced bleed, which doesn't mean anything. So, there's no reason to have a monthly drug-induced bleed, which is why we get these headlines, these crazy headlines saying things like women don't need periods. They are,
oh my goodness.
What that's referring to is women don't need a monthly drug-induced bleed from the pill, which we totally don't. Like there's no reason to bleed per se if it's not part of a cycle with ovulation and making of hormones.
Got it. No, that's,
yeah.
And I love that you flipped the switch, because what also I've been observing in women's health is when it comes to ovulation, people tie it so much to getting pregnant, and even the apps, they're referred to as fertility tracking apps. And I wish that the whole conversation would change to just reproductive health, or even women's health. Because even when you say reproductive health, people automatically think baby, and it all runs together. And that's honestly why I created this podcast, because I want women to understand these things. Like, it is like, women's health is not period, ovulation, as you mentioned, get pregnant, you have menopause. Like, it's a whole system that is a magical system, and it's not one piece of it depending on whether or not you want a kid or not.
Absolutely. One way of talking about it might be to speak about ovarian hormones. Ovarian hormones are beneficial for general health, just as testosterone or testicular hormones are important for general health for men. Testosterone's not just for making a baby, right? Like, which is actually, it seems so obvious when you say it about men, but like, unfortunately, when it comes to women's health, there is kind of this idea, it's like, well, if you're not going to make a baby, do you even really need any of that? Like, do you need those hormones? That's sort of, well, that's definitely what's going on with hormonal birth control, because it shuts them down.
I recently spoke with the Ovarian Cancer Research Alliance. One of the questions that I had asked them is this very tough position that women seem to be in with birth control, because apparently with ovarian cancer, having children is helpful in, I guess you could say, preventing it, but also being on birth control.
Yeah.
Tell me about this,
anything that puts the ovaries into dormancy is going to reduce the number of cell divisions happening in that tissue, right? So I've thought about this a lot. So yes, hormonal birth control decreases the risk of ovarian cancer, just as, chemical castration of men would probably reduce the risk of testicular cancer. Like, anything that reduces the activity of that tissue.
Right.
Yes. But the thing is, in terms of that question, it depends your history. Like, if you have a very strong history of ovarian cancer or something, that's obviously a different conversation. And that's a conversation to have with your doctor. But let's just say your average woman who has no, risk factors specifically for ovarian cancer. Like, it's quite a rare cancer compared to other health events for which the risk is reduced by having ovulation. So by having active ovaries, having regular ovulatory cycles, menstrual cycles, reduces the risk of a number of diseases. I'm going to quote my colleague, Professor Geraldine Pryor, who's a reproductive endocrinologist. If you ever had a chance to have her on your podcast, she'd be a great guest. Yep. She's in Vancouver. She helped me with my book. There's a quote from her that I've quoted several times. She says quite boldly that 35 to 40 years of ovulatory menstrual cycles, regular natural menstruation, helps to prevent osteoporosis, dementia, heart disease, and breast cancer. And she puts breast cancer in there because progesterone, the real progesterone we make after ovulation, has an anti-breast cancer effect, which, and this is a perfect example, because the progestin drugs in hormonal birth control that are called progesterone, unfortunately, they're not. Progestins increase the risk of breast cancer. So progesterone lowers the risk of breast cancer, and progestins increase the risk of breast cancer. So if we're talking about, all cost benefit, what is the cost benefit analysis of having regular ovulatory cycles throughout your life? On the beneficial side of the ledger is reduced risk of all those things, including breast cancer, which is obviously a lot more common than ovarian cancer. So that's kind of my short answer to, does ovarian cancer reduce, or does the pill reduce the risk of ovarian cancer? Yes, but big picture, there are lots of other considerations.
Okay. Back to the birth control then, since we started to talk about that, help our listeners understand more about the impact of birth control, because I know that even in your book, you had referenced that certain types, if you really need them for certain cases, are better than others.
Okay, well, let's start with the hormonal IUD,
please,
as I guess I would say a better option. So we'll start with the positive, rather than just bashing the pill.
Yes, absolutely. And even in your book, I guess, just to be clear for everyone, it is not like Dr. Briden said birth control is the worst thing you can ever take.
No.
But I think it's there. You had definitely strong suggestions around precautions. And so this is about creating awareness so that women have freedom of choice. So thank you for making sure I clarified that.
Let's start with, arguably, through my lens, why the hormonal IUD is a bit better. So just to clarify for any of your listeners, I'm sure people, depending on what generation you're in, you know that an IUD is just intrauterine. It's a little plastic device that's done in the doctor's consulting rooms. Like it's not a surgery to have that. You just insert it up through the cervix. It stays in there for a number of years, between 3 to 5 years, depending on the type. And there's a non-hormonal type as well, which we'll leave out of this conversation. But the hormonal one contains levonorgestrel. It's a drug. It's a kind of similar to progesterone, but also actually quite similar to testosterone. So there could be some effects from that. But the advantage of it is that for one thing, it lightens periods quite dramatically. So that can be very welcome effect. Like it thins the uterine lining and lightens periods by up to 90%. So that's definitely something to acknowledge. It prevents pregnancy. It does not routinely switch off ovulation. So you can kind of see why, from my lens, I prefer that. So I just spent the first 10 minutes talking about how important ovulation is for women, for making hormones, for building long-term health, all of these things. The hormonal IUD is quite unique in that it doesn't switch off ovulation. Sometimes it does suppress ovulation to some extent, especially during the first year when the dose of the drug is higher, but that's not how it works. It's working locally in the uterus. So it's quite unique in that sense, in that you can, oddly, actually, with the hormonal IUD is one of the only times when you can ovulate or cycle but not bleed, which is very interesting, which is actually the opposite, the complete opposite of what happens on the pill, which is that you bleed but don't ovulate or cycle. So they're very different sorts of things. So that's an example, I guess. All that said, there are downsides, of course, to anything. So I have a blog post called The Pros and Cons of the Hormonal IUD, which I've been told is quite balanced. So people can look there and look at all the different pluses and minuses of that technology. In terms of the other types of hormonal birth control, they're all, beyond that, I mean, they all share in common the fact that they do suppress ovulation. Definitely any combined pill, like an estrogen progestin pill, works by suppressing ovulation. The progestin-only methods, like the implants, the mini pill, the injection, actually, I really don't recommend the depot injection for reasons we can get into if you want, but I would say not that. But the other ones, the progestin-only ones, they don't always suppress ovulation, but they usually do. So that's through my lens, that's the problem. I mean, then there's the side effects of the contraceptive drugs themselves, which varies depending on which drug it is. And, they've been linked to mood, hair loss is a big one, mood problems. So we kind of have the layer of, okay, you're being robbed of your own hormones and the benefits of ovulation. And then on top of that, you've got potentially the side effects of the progestin drugs, which it's interesting because I was just actually last night having a discussion with my husband about this very topic. Like, is the pill safe? The kind of that question, like, is the pill safe? And I think in answer to that, you'd have to say, define safe. Like, is it safe in terms of, severe side effects? Arguably, big picture, probably arguably yes, although some women do die of blood clots from hormonal birth control. That's a reality. But big picture, most women do not get anything sinister from hormonal birth control. So from that sense, it's safe. But on the other side of things, like what we're starting to now understand that a number of women experience mood changes, if you will, or mood symptoms from contraceptive drugs, potentially can contribute to hair loss, depending on the type. It alters metabolic function. It changes the shape of the brain. So these are things we know, like about some of what those contraceptive drugs are doing. And these are things we're only learning 60 years later, right? Like they had no idea of any of that back when the pill was approved. We're just now starting to kind of think, oh, how does it, like I read a scientific paper, they're like, okay, wait, how do these contraceptive drugs affect the brain? And also, why are we just asking this now?
Well, yes, that was actually going to be my question is why now?
Yeah. So it's a more nuanced answer. Like I guess in some ways, yes, it's safe. It's been used by hundreds of millions of women over the years, but not that long, over 50 or 60 years. And in other ways, we've got women who've experienced, for example, depression from the pill, but were not heard when they said that's what was happening, right? Like that's the other part of this conversation is really for generations, women have been saying, oh, this pill affects my mood. And then sometimes the message back to them is, oh, you're just imagining things. Like that's not a thing. But it is a thing. So now we know, we do have some research. There was the big Danish study in 2016, a huge study. It was correlational only, so it didn't prove causation, but they proved not a strong, but a definite link between all types of hormonal birth control, including the hormonal IUD, and negative mood outcomes. And even the authors of that study at the time said that was probably an underestimate of the problem because they were only measuring women who actually went on to take antidepressants, not girls who just quietly stopped taking it, right? Like those weren't even counted. So it was the women who kept taking it and then ended up on an antidepressant. And that's something I see quite often, especially with younger, like teenagers. I might hear a story from a patient. I'm looking at her list of medications and she's on like Yasmin, the pill, and then she's on an antidepressant. I'm like, what order did those come in? And it's like, okay,
that's a good question.
Yeah, the Yasmin at 15 and then about 9 months later, an antidepressant. It's like,
wow.
Yeah, I've heard that story before.
Oh, geez. And, it's funny, there's some doctors that I've interviewed, and it's really interesting to just hear how the OBGYNs are trained. And it does seem like birth control is, such a solution. So for those, for those of you listening, I wanted to bring this up because I know this is National Period Day, but I wanted to make sure we talked about the birth control because a lot of it is around, the period and ovulation and controlling the cycle and, just really understanding the impact of it is so critical because it does seem to be, quote unquote, the magic pill that is used in OBGYN offices for various issues that women have. I mean, you even mentioned in some cases, if you're having a heavy bleed, they'll give it to you.
Part of this is semantics, right? And I know they're just words and words.
Yep. No, this is important.
Words, but words are part of the problem here.
I know.
So two words that we need to sort out.
Please.
Okay. One. Yeah. The phrase that the pill can regulate is the word that I'm taking issue with. Regulate the menstrual cycle is wrong. Like the contraceptive drugs do not regulate anything. They switch off ovarian function and replace it with contraceptive drugs replace hormones with contraceptive drugs that then, because of their dosing, induce a drug withdrawal bleed. So that is not regulated. If the menstrual cycle is an ovulatory menstrual cycle where you make estrogen and then progesterone, and the pill works by completely shutting that down and inducing basically chemical menopause, that's not regulating, right?
Like I don't disagree with you at all.
We could say, like, I'm just thinking of other ways. I think if they spoke to women, like in terms of what's actually happening, it would start to change. You just start to change the whole conversation. It's like, okay, I'm going to give you this. So what more accurately would be like, these contraceptive drugs are hopefully going to relieve your symptoms. Okay. So that may be something we can work with. And by shutting off your ovaries, something like that. I mean, that sounds bad, but that's some women might say, okay, I understand what that means and I still want to do it. And that's fair. Keeping in mind that, just circling back briefly to the hormonal IUD, works differently. So it does lighten periods without switching off the ovaries. So that's a different conversation.
Yes.
The other word that I want to, so regulate cycles is one, I'd like to see that change. And the other one is period itself. The word period, I feel, should be reserved for the bleed at the end of a proper natural menstrual cycle. I feel like a pill bleed, I use the word pill bleed. It's a withdrawal bleed. Like with my own patients, when they're talking about what their periods were like on the pill, I just say, okay, well, that's fine. But they were pill bleeds that you were having, drug withdrawal bleed for, every month for 10 years. Those aren't periods. And we can't compare them to what your own periods might be like. It's like apples and oranges. They're completely different things. So those are my two semantic clarifications around what's happening.
And I appreciate that. And this is also why I wanted to interview you, because I can tell from even what you put on social media that you're very serious about the information women have and know about their bodies and really trying to create change. And I so welcome what you are doing, and it is needed. So in the 5 years since you wrote your book, what would you say some of the changes are that you have seen? Because I know there are these semantics that you'd love to change, and it's like one patient at a time, one person at a time. But what would you say are some of the great things, besides just people talking about it? Maybe we still have to work on terminology, that you're happy to see in women's health.
Yeah, I think, the fact that we can say period so easily is a very beneficial, like very positive development. I think also there does seem to be, and maybe I'm just imagining it, but like there does seem to be more of a sense that what women's bodies are doing is a good thing and not, always a liability. It's like that women's hormones themselves have benefits. And so I feel that's part of my key messages. Not to overstate it, this is going to sound a bit extreme when I say it, but I actually feel sorry for men that they're not that they don't have women's hormones. Like, I think estrogen and progesterone are so awesome and, potentially give us so many benefits that, I guess sometimes when I talk about it, that, and this is true, actually, the female body is the standard version of a mammal body. Like, we're all, I don't know if you know this, but like, we're all, when we're fetuses in utero, we're all female until week 6 when the maleness factor kicks in. So, and also female kind of evolved first from an evolutionary perspective. Estrogen was the first hormone to evolve. So there's lots of beneficial things going on with the female body that is, so I think just reframing it that way has been, it's been good to see. I think women respond to that. So it becomes a message of celebrating what the body itself, rather than like being negative, about the pill. There's sort of two sides of the same thing. So if you can't really talk about the benefits of ovulation and the benefits of hormones without then acknowledging that these hormone suppressing drugs are potentially a problem.
Right. No, I completely hear you. And I do encourage women to just continue understanding how all the hormones and how our bodies work and why, because it is amazing. And it is incredible to see the signs and symptoms that we have. Like right now, for the past 2 weeks, I've had a lot of headaches. Now, it could be because my kid is starting school and the school system can't make a decision on when school is starting, but I'm pretty sure it's also hormonally related. But I know that because I've been doing, the podcast, I've been studying women's health for a decade. Like I now know, like I probably should get the hormones checked and see which one's off.
How old are you?
I'm 46.
Yeah. Okay. So my next book.
I know. I'm so excited. Tell me.
So I wrote a book about perimenopause, which is our 40s, basically. It's all our 40s. I mean, pretty much if you're 40 something, you're in perimenopause almost by definition. It's a pretty interesting time too. And I'm very passionate and excited about some things about perimenopause that once again, feel like are not being kind of discussed in the right way. So one of the main things, just in a nutshell, like one of the big things that happens in perimenopause to all of us is the hormone progesterone goes. Yeah. It's like it leaves the stage, not completely, but it really does start to go down. And it's nothing you're doing wrong. Like, I think you could try to keep it going as long as you can and be as healthy as you can, but that's just the nature of it's second puberty. So in first puberty, estrogen comes first, loads of it usually, and then progesterone doesn't kick in for a couple of years. That's why young girls, like 13-year-old girls, can have quite heavy periods and irregular periods. It's like there's no progesterone yet to exert its period lightening kind of calming effect. Then in a mirror image of first puberty, we get second puberty where estrogen goes crazy, higher than ever before, and progesterone just slowly drops away. Yeah. And that can manifest in different symptoms, which of course I've written a whole book about, which I'm excited about.
When is it coming out, by the way?
March.
Okay. I will definitely mark my calendar and read it. One of the things you were just talking about reminded me of another point in your book that I've always wanted to ask you, and I had kind of forgotten about it until you brought this up, which is about how the period evolves in a woman. So you were talking about how it takes a little while for the period to normalize when a young woman first gets it. It seems like when the girls are young and they're having that heavy bleed, a lot of people put them on the pill.
I know.
And is it because the doctors aren't patient enough to wait for the period to evolve to where it's supposed to get? Like, is this happening?
This is happening. Girls are being put on the pill very young. Now, to be fair, no one likes to see an 11-year-old girl bleeding through her sheets at night. Right. I've had some young women in my life. I know it's distressing. Like, so that definitely you want to help them. So fortunately, which is in the book, and I have a blog post about it, there are ways to lighten the periods of young girls that don't involve the pill. Like that you can help them. It's not a question of just leaving them to it. But also, yes, so there is this other element of understanding that the menstrual cycle has to mature. And that usually takes a year or two for progesterone to start to kick in. So most girls aren't going to have to go through that heavy period phase for too long. Right. But bigger picture in terms of properly maturing, like gaining what's called a robust menstrual cycle, one that is not going to be pushed around by too much by stress or under eating, it keeps going, takes 12 years. That's according to, again, Professor Pryor, endocrinologist who helped me with my book. She has a stat, which I cited in the book, so you can find the reference there, that it takes 12 years. So if you get your period at 13, it's not till you're 25 that you're in all your progesterone, robustness, right? Like you're really doing it by 25. Your peak fertility probably around that time, in terms of progesterone production. There are other factors in fertility as well. But the interesting thing is if you interrupt that by switching off the menstrual cycle with contraceptive drugs, that maturation process can't happen, which is why you then get women coming off the pill in their early 30s and can't immediately get a regular menstrual cycle. Look, they get there, you should get there eventually, but so when I'm working with patients, just understanding this process of maturation of the menstrual cycle, one of my first questions would be, so if they're trying to come off the pill in their 30s, say, and the thing I need to know more than anything else is, did you have any years of natural cycling? Did you have any opportunity to mature your menstrual cycle. Because my experience is, even if they had even a couple of years, even better, like 3 or 4 years, if they didn't go on the pill till like 15 or 16 or 17 or something like that, and they had some semi-regular cycles before that, then I say to my patient, you're going to be okay. Like, I think it's going to be okay. Like, your body is going to remember how to do that. You had an opportunity to do that. I think in the book, this is all in chapter 1 of Period Repair Manual, I talk about the hormonal rivers. It's an analogy. I've had some people like that analogy. Just it's the hormones learning what they're supposed to do.
And so it's important. If you don't have that, it's a little bit hard. It's harder for the hormones.
It's just harder. It just takes time. And it can mean you're more, for example, the best example is undereating. So young women, undereating can cause women to lose their period, especially if they're young, or especially if they don't have a menstrual cycle that's really sort of matured. And severe undereating will always shut down periods regardless. But milder undereating or milder stress is going to be more of a problem for women who don't have a robust, mature menstrual cycle.
Okay, got it.
Yeah.
And then as far as, and maybe with the 5 years of people being more comfortable talking about periods and more conversations happening, people still get it. But just in case there's still questions out there, tell us about a normal period. And here's why I asked this question. These fertility tracking apps, because that's what they're calling them, they will ask, is your period heavy, medium, or light?
Right. Yeah.
And I was talking to somebody and they brought up a really good point, which is, what does that mean? And like, as an example, like as a woman, because remember, the app is just an app. You enter the data and it has to calculate. But to the woman, are we all defining this the same way? So as an example, does the woman compare heavy, medium, light between day 1 and, if there's a 5-day cycle, day 5? Is it between day 1 of this cycle versus the previous cycle? So can you educate women properly on like what, because we aren't taught this. We're just told you get this, and we're even told it's terrible.
It's very subjective. It is. Like, I've had interesting conversations because I get to ask, I've asked thousands of women about their periods. So I get to, and I ask how much, and we try to quantify it, which I talk about in a minute. So I get to hear women say, oh, yeah, my periods are pretty heavy. Meaning I have filled 2 regular tampons in a day kind of thing. I'm like, okay, actually that's not that heavy. Or I get women who are like, oh, I'm like overflowing my menstrual cup 3 times a day. But it's not that bad. Like, yeah, that's heavy. So like the range of normal. So I mean, because I'm Canadian, New Zealand, I talk in milliliters, but that's 25 between sort of, I'd say it can be quite light as normal. So it can be as little as, say, 15 or 25 milliliters, which is really just a few teaspoons over all the days of the period, or anywhere up to 80 milliliters, which is several tablespoons over all the days of the period. The period shouldn't be more than 7 days. That's the other parameter. Like, a proper ovulatory cycle shouldn't be more than 6 or 7 days. If it's longer than that, something's wrong.
Right.
So 80 milliliters is actually not that much. It's not uncommon, to be fair, to have heavier than that. So, and in fact, during perimenopause, the crazy heavy periods that some women get during perimenopause, it can be like not 80 milliliters, but like 500. So, you get a sense of the scale of things. Like, some women might lose like a couple cups, which is, a lot. Like, so those are the women who end up having, well, they used to give them hysterectomies. When I started practicing, like, uterus removal was what happened for that situation. But now it's hormonal IUD usually, which is, I would argue, better than a hysterectomy.
Yes. So, but younger women argue the same thing.
Yeah. Most younger women aren't going to get like 500 milliliters. Like, they're probably, women in her 20s, 30s might be up into, if she's having an ovulatory cycle, she could maybe be up to like around 100, 120 milliliters. So in the book, in Period Repair Manual, and not just there, but lots of places, you can find how you calculate that. So like a regular full tampon, a regular tampon filled is about 5 milliliters. A super tampon is about 10. If you use a menstrual cup, it's a lot easier because you could actually just look at how much, the cup holds 20. So you kind of roughly have filled it. So it's like 10. You can start to tally up, figure out how heavy it is. And of course, the real problem with heavy periods, apart from being very annoying, is iron, because it depletes women of iron. So it's not a small problem. Like a heavy period, depending on how heavy, it can be quite depleting to health. And being iron deficient is not good for immune function, or causes hair loss and all sorts of things. So
no, absolutely. Now, I'm curious, tampon versus pad versus the menstrual cup. Are there any, I mean, outside of tampons, obviously making sure that they're 100% cotton and organic, anything that, like any specific preferences or concerns that women should have about either of those options?
I think they're all okay. As you say,
Okay.
like I think if you're going to be inserting something, I think it should be an organic cotton, not have little bits of nylon fiber or like dioxins, which I don't have anymore. But I personally prefer menstrual cups. I think they're more comfortable. I mean, but I don't insist that everyone has to use a menstrual cup. No, okay. I think it's at least worth kind of knowing that they're out there and that they're actually pretty easy to use and environmentally friendly. So,
okay.
Yeah.
No, thank you. I just didn't know if there was like because I know that there's, it's wonderful that the menstrual cups are really becoming so much more commonplace. So go ahead.
No, just for what it's worth, they do seem, for women with very heavy periods, the menstrual cups do seem like a better option. I don't, some women claim they lighten periods. I don't know a mechanism how that would happen, but I think maybe it's just they hold more and you can kind of keep better control over what's going on with a menstrual cup.
Okay. No, that's very helpful. Anything else that you want to make sure on National Period Day that women know? Because, we've talked about so many great topics about, it's not just the period, it's really about ovulation. And that's what this is all about. And just helpful information about the birth control as well. Anything else that women should know, a top line, before they read the rest of your book for all the details?
Okay. Severe period pain is never, ever normal. Never normal. So I differentiate, as do many other people, in my book, I talk about severe pain, like so-called normal period pain versus severe period pain. I would argue pain is never normal. Any amount of pain is really not normal, but it's common to get a little bit of cramping. You can take a ibuprofen and it goes away. And that's nothing sinister is going on. That's just sort of a normal situation. If you're curled up in a ball and can't go to school and, are crying and vomiting, and there's something going on. And that something can be endometriosis. So it really is worth mentioning at this point, that specific condition, which we could do a whole podcast on one time, but it's about 1 in 10 women and girls. And it usually hits quite young. And unfortunately, as you probably know, it can be undiagnosed for years. Yeah. And especially because it often runs in families. So then you'd have girls being told by their mother, or older, aunties, is like, well, this is just how it is. This is what periods are like. And so the activism around endometriosis is just to explain, no, this is not a normal situation. And then, of course, then there's the next question of how do you treat it? And that's a whole other conversation.
Well, I interviewed Dr. Tamara Sechkin, who did my endometriosis surgery. Okay. And it's quite a popular podcast. Okay, so definitely
link to that one.
Yes, definitely a topic that needs to be discussed further and I appreciate what you're saying about the period pain, because we women grin and bear it. And so when you were saying pain, I'm like, I hope you describe it in great detail, because we women are like, this is how it is. And the moms and grandmothers and aunties are like, this is how it is. And it's not the case.
So my experience, I'll just share, because of course I've had the opportunity, and I'm very grateful for that, of just hearing the stories, like speaking to thousands of women over the years. I don't personally have endometriosis, but I've had many, like hundreds, if not thousands of women patients who do, and then patients who don't. And I can tell you, I think women who don't have endometriosis have no idea of what pain is, but I mean, like, I sort of feel like the pain that women with endometriosis put up with is so off the scale compared to what other people think would be acceptable, that it's just quite interesting to see that perspective, that it's pain at another level usually, although it can be milder pain and still be worth treating, but the pain can be, and it shouldn't be like that.
No, I know. And I'm so glad you're saying this. And for those of you who do struggle, like, what would be your words of wisdom to the women who are in severe pain and aren't being heard? What would you say to them? I mean, you're a little girl in a lot of pain and everyone's like, it's fine. This is how it is.
I just say it's not normal. We're going to try to get you some help. then there's a question. I mean, there's so many aspects to this that I'm sure you spoke about on your other podcast, but like it's at finding the right special, I do feel like girls with endometriosis need to be under the care of a gynecologist who knows about endometriosis and who, is going to be able to assess it properly. There's on the radar now, we can put in the show notes if you want. As you know, they're working on different non-invasive methods of diagnosis, but there's a couple of Australian surgeons, Matthew Leonardi, I think is what I follow him on Twitter. They've done a couple of scientific papers recently about using ultrasound to diagnose. So as you know, like a normally done ultrasound cannot pick up endometriosis. So, but there's a specialized way, like you can, if people who know what they're doing can use ultrasound in a way where they can sometimes pick it up. So to me, that's a positive development. It just means, there might just be more information, without having to make that rather daunting decision of, okay, the very first step is surgery, because that's hard. Like it's hard for anyone to do. Yeah.
No, absolutely. So what is your greatest hope for women's health?
Yeah, I guess that we collectively have a greater understanding of how the menstrual cycle works and the benefits of hormones. This is more than one thing, but also I would really like to see new methods of birth control come down the pipeline, like just completely thinking outside the box, different ways of avoiding pregnancy, of which there's a couple coming, which you probably know is one called vasal gel. There's a couple of male ones coming, but I feel like the burden of birth control, and particularly hormonal birth control, has been on women for too long. And we get locked into this conversation about access to hormonal birth control. It's like, okay, fine, but it is 2020. Like I think we could have access to some other types of avoiding pregnancy. It shouldn't require, avoiding pregnancy shouldn't require shutting down the entire hormonal system of a girl. Like it just shouldn't. Like we have the technology, surely. So, and unfortunately there isn't, as you know, there's not a lot of research. There's not a lot of funding. Like the vasal gel, it's a male method, a non-hormonal method. I don't know if you know this, but to get it into clinical trials, they had to crowdfund. They had to do like a Kickstarter kind of thing, because no pharmaceutical company wants anything to do with it. They're actually not interested. I guess it's not profitable for them to come up with new technology for birth control. So it's going to have to happen in the crowdfunding space, I would think.
Oh my goodness. Lots needs to be transformed. Well, thank you for your time. It's been a pleasure to get to know you, and please keep doing what you're doing. We need you. Thank you for writing, and thank you for now writing your next book in March about perimenopause. I look forward to reading it.
Thanks, Georgie.
Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find the link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.